of them experienced less phobia problems, and most of the studies were done on acrophobia. So anyway, for all those people out there who have those phobia issues, very helpful. 5-HTP raises serotonin. Now we have to be kind of careful with this because sometimes when you raise serotonin, it can increase anxiety. But if you have a depression associated with the anxiety, 5-HTP might be something that you might want to give a shot. 50 to 100 milligrams a couple of times a day can be very helpful. As with all of our shows, diet, diet, and diet. Complex carbs at every meal in combination with some source of protein. Fruits and vegetables to alkali the blood. Once again, avoiding the caffeine and alcohol. Refined sugars and processed foods causing extreme sugar changes. And then avoiding allergy triggering foods. Most of these we already reviewed, but I wanted to throw this diet section here just so you have an idea of lumping all the diet types of benefits if you do some slight modifications. Exercise releases stress hormones 30 minutes a day. Whoa. You will notice a big benefit. When I miss my exercise or I have other things going on, which is rare, but sometimes I do, I don't feel near as good and I don't get rid of the stress hormones. So the excellent to do it in the afternoon when you get off work, because if you do exercise too late in the day, it can keep you awake. But strongly suggested to release cortisol stress hormones, reduce. Yoga. I thought this is kind of funny. We know yoga reduces stress, you know, the little pretzel moves and all, and a lot of them are actually very simple and can be done with a lot of ease, but some of them are a little bit more complex. OCD is a form of anxiety. Substantial help with people who suffer from OCD anxiety. Yoga. Go figure, huh? Somehow, some way, it just helps with the movement of energy in that regard. Relaxation techniques, counseling. You can get a good counselor to help you deal with the actual causes of the stress and maybe perhaps give you some coping skills to deal with things that help trigger anxiety, to learn some particular breathing types of skills, relaxation techniques. These are all available out there with a good psychologist. No drugs, we're talking psychologists who can work with you on those type of relaxation techniques. Next, we're going to be moving on to the fitness portion. I'm going to show you a couple of pressure points you can use that can help relieve anxiety. Thank you. Hi, welcome to the fitness portion of our show, although I don't know if I should call this fitness or a exercise and energy. That would probably be a better way to put it. I'm going to show you a couple of pressure points that you can press when you're having anxiety, when you're in the middle of nowhere, that may be able to help reduce some of that anxiety and center you and balance you a little bit more. This one is actually virtually you're almost hugging yourself, and what I suggest is there's some pressure points right here between, if you look at the muscle, there's some separation here. You're going to press your thumb into that, your thumb in on the other side, and you're going to just kind of hug yourself a little bit. You're going to hold those areas. Oh, actually, I can actually feel. It's very, very calming. It holds that particular energy. You can actually even massage it a little bit in that regard as well, too. Hold that area probably for about 30 seconds to a minute, and then you can switch over and do the next one, which will be on the wrist area about 2 inches above the wrist. And what you're going to want to do is you're going to press right in this area, right down here, okay? And hopefully that angle is better. Look at all my veins sticking out there. And you're going to press right in, pretty much right in the middle, right there, maybe a little bit off towards the bony part here. And just kind of hold that down. And hold it probably for about 30 seconds. And then you can change it over and hold it for about 30 seconds more. Something that works really good with kids' anxiety, and actually adults can do this too, is your fingers in Oriental medicine, something called Shinjin-jitsu, have a lot of energy to them. And sometimes just holding your fingers, hold the finger up, and you hold it with the opposite hand for about no, what, 15 seconds to 30 seconds, and just kind of hold them there. It gets you in balance and very focused and in what we call the now, so to speak, to where you're thinking about doing something here and you're not focusing on your anxiety or your stress. Give those a try. I hope that'll help. Next, we're going to be moving on to the research portion of our show. Thank you. Welcome to the informational research portion of our show, and with us today is Ralph Turchiano. Ralph?
Thank you for that intro. And the first article we have comes down to postpartum obesity, otherwise the baby fat after having a baby. Now, what they discovered recently out of the European Congress on Obesity, yes, there is a Congress on Obesity in Europe, that discovered that basically that's something very interesting called probiotics. Probiotics, especially Lactobacillus and Bifidobacterium, what they discovered was this. This has nothing to do with exercise, diet or calorie intake. All it was by getting these probiotics to women after they had a baby, and they followed it for 1 year. Those women that were taking those probiotics, Lactobacillus and Bifidobacteria, for 1 year after, only 25% of them maintained any midsection obesity. Compared to the group that wasn't taking anything, 43% of them had midsection obesity. So they know, just by using just 2 basic probiotics, something that used to be commonly found in our raw milk and dairy and cheese many years ago before we pasteurized and homogenized it to death, they made a tremendous difference in the obesity after having a baby. Pretty interesting, cheap, simple, extremely healthy. Now, an interesting tie-in potentially to anxiety. A long time ago, I'd say probably about 4 or 5 years, that's a long time, one of the most common herbs for anxiety taken out there was kava. Well, recently at Queensland University, or say Queensland in Australia, and in the journal, Springer Journal of Psychopharmacology, they recently discovered that kava is safe, and not only that, very effective when compared to placebos, other antidepressants, other anti-anxieties, medications. What they discovered was this. The primary reason the kava was causing issues before in Europe was basically poorly made, especially kava that was extracted with acetone and ethanol. And on top of that, they tend to use the wrong parts. And they basically said, quote, our study used a water-soluble extract of the peeled rootstock of the medical cultivar of the plant, which is approved for therapeutic goods administration in Australia and is currently legal in Australia for medicinal use. This is cheap, effective, and what they're hoping for is the ban be removed and that they found out the true cause. Well, good luck on that. Bone density. Osteoporosis, more so than anything else, spinal fractures. What they discovered, another cheap thing, is by adding DHEA, which is a pro-hormone, to basically calcium and vitamin D, they were able to reduce spinal fractures down by 30 to 50% after 1 year. Also, in addition to 1 year, those who were taking calcium and vitamin D actually did get a good increase in bone density by 2%. But those that took DHEA, calcium, vitamin D combination, had a 4% increase in their bone mineral density overall. Now again, this study was primarily done just in women, and the benefits seem at this point to be only for women, especially since they drew the correlation between low bone density and low DHA levels in females themselves. Very simple, very inexpensive, but since DHEA is a pro-hormone, it's something I really would like you to consult your doctor ahead of time, especially for people that are prone to hormonal cancers, just to play it safe. And the woman took it for 2 years with no noticeable side effects, but still, each person is different. Check with your medical practitioner first. All right, here's one for out there and all those people taking antacids, especially one, Prevacid. They've discovered one thing with some individuals who've taken Prevacid for about 6 months or longer, and that was called chronic diarrhea. In fact, so bad, they was found out they were being diagnosed with colitis. Interesting part about it is when these individuals that had taken Prevacid were also being diagnosed with colitis, they were given the sulfasalazine for 2 grams a day to treat the colitis on top of that, and still it came back after 4 to 5 months until one innovative doctor said, hey, you know what? Let's take them off the Prevacid and see what happens. Guess what? Almost immediately the diarrhea stopped, and on top of that, the situation began to improve and the colitis began to go away almost immediately. Where are you going to find this article? You'll find this article in the May 7th, 2009 World Journal of Gastroenterology. Very interesting, and that's like Prevacid OTC. Tons of people are taking it. They may have no clue what's going on, but man, what a simple fix. This is something about not what you take, but what you don't take, if you can do it. And Ben, it was instantaneous. And they also said too, correct diagnosis and treatment without the knowledge of what this medication does, quote unquote, is impossible. So something to think about when you go to get a diagnosis. They also said most doctors are fully unaware of it. All right, now here's one for midwives. Now, the United States, about 99% of all births happen in hospitals. All right, and there seems to be extreme conflict between medical practitioners, or I should say doctors, and midwives. So they noticed there was a high level of premature births in this one town in Oregon, so they went to go see if it was the midwives that were causing it. They found the exact opposite to be true. In fact, what they said, basically, after the research, in fact, this is quote unquote, that the home births documented all had successful outcomes. Now, this caused Oregon State University researchers to look into a little bit more. They found a chronic distrust, almost an antagonism toward midwives, and trying to blame them for any infant mortality issues that may happen in the United States. By the way, the U.S. is about #1 in infant mortality among all developed countries. Yet again, 99% of our births happen in hospitals. So then they looked a little bit further back, and they wanted to compare it to a country that had a high level of midwifery or in-home births. Well, guess what? That would be like the Netherlands, where about 1/3 of all births take place with a midwife. In fact, how much less infant mortality than the United States? Well, guess what? About 1/3. Something to think about, and wonder why we have such antagonism between those two groups. And then antidepressants. Once again, another article came out and found out they don't do any better than a placebo except for small subgroups. Yet they're still out there and they're still being marketed for something totally wrong. In fact, why? Well, they discovered that the drug companies were basically picking and choosing who they can use in these clinical trials. In fact, how much so? Well, they took 325 people who were depressed, and they went to go see how they went with the clinical trials. Well, those drug companies will reject anybody that had depression for over 2 years. In fact, of the 325 people they took, only accepted 9.2% for clinical trials. It's nice to have your own clinical trial when you can pick and choose the people you want to have the outcome come out the way it is. Something to reconsider. Try therapy, a good counseling, something else. Don't be stuck with a drug, especially one that doesn't work no matter how much your copay pays for it. And thank you very much.
Thank you very much, Ralph. We appreciate the information. Once again, do your research, look up all the stuff we talk about, find out what's best for yourself, and discuss it with your healthcare professional. Thank you very much for joining our show.